Hello, my name is Adam Waller, and I'm going to do the abdominal assessment. I have washed my hands, I've introduced myself to my patient, and I have assigned consent for treatment. First, whenever I do the abdominal assessment, I'm going to do it in a certain order. So I'm going to do the inspection first, and then I will do auscultation, percussion, and then palpation. First, I'm inspecting, so I'm just watching for the abdominal rise from respirations. I'm also looking for contour, I'm looking for symmetry, I'm looking at the skin color, coloration, I'm looking for any herniation, ascites, that kind of thing, and don't really see anything like that here. Very healthy abdomen. So then I'll also look for pulsations. The abdominal aorta runs right in the middle, right above the umbilicus, and so I'm kind of watching for that as well. And then of course it branches, goes to the iliac artery, and then femoral part of the artery. So I'm just watching and looking at that. Next, I'm going to go ahead and listen with the diaphragm of my stethoscope in all four abdominal quadrants, starting with the right lower quadrant, moving up to the right upper quadrant, over to the the left upper quadrant and left lower quadrant, and I'll look in two spots in each quadrant, or listen. You can just breathe normally. I'm listening for the bowel sounds, the large and the small intestine. I should hear some gurgling in there. And if I have to wait longer than 5 minutes to hear a bowel sound in either one of the quadrants, then I'm concerned about constipation or peritonitis, that kind of thing. Okay, next I'm going to listen to the abdominal aorta, and then that branching into the iliac aorta, and then the femoral with the bell of my stethoscope. And I'm listening for bruits. I should not hear a whooshing sound, which would be a bruit, and that may indicate an aneurysm. This is the iliac artery, the right side and the left side, and then the femoral artery is down lower, right around here. I can go ahead and palpate while I'm here the femoral artery on both sides, and then the inguinal lymph nodes are here as well to check for any inflammation. There may be a sign of infection if the inguinal lymph nodes are enlarged. Okay, now I'm going to percuss the quadrants, and I should hear a good timpani sound to the percussion. I'm going to use my left non-dominant hand and then percuss with my dominant hand. Should be a nice timpani sound to it because it's hollow. Okay, and then I will percuss up here close to the liver. The liver should be right here on the right upper quadrant, and it should be dull. And I could actually start up here in the middle of not hitting the rib cage, but getting in the middle of the ribs, intercostal area, and finding the liver, which should be 6 to 12 centimeters in an adult. Okay. Next, I can do the scratch test, which is where I'm listening while I gently scratch the patient's skin and I should hear it getting larger as I get closer to the liver. Again, just a sign of the liver placement and if the liver is enlarged or not. Next, I'm going to palpate in all 4 quadrants. I'm going to do light palpation, and I'm just palpating just very gently, lightly, and I'm feeling the small bowels and the large bowels there. And then I can go a little deeper palpation. Feel the small bowels, and I can palpate here the liver. Take a deep breath. Good, yeah, the liver is right there. I should not be able to palpate the spleen. If I could, then the spleen would be enlarged. Also, rebound tenderness is something that I would look for, so I would just press a little deep here in the McBurney's point, and then release quickly. Did that hurt, or is that painful at all?
No.
So that would be a indication of appendicitis if there was a lot of pain there. And that concludes my abdominal assessment. Thank you.